Hello everyone, this is Chadi from CVI 2023 in Austin. I'm really privileged to be with Dr. Mina Youssef. He is one of the finalists for the challenging case at CVI. Mina, always nice to see you.
Hi Chadi, same for me.
Can you walk us through the case for the one you brought to the CVI?
Yes, it's a 7-hour case that took me 7 hours in the cath lab. Oh. It started simple. It was a patient of non-STEMI, bifurcation LAD with diagonal. After stenting the LAD, the diagonal was lost. While trying to re-enter the diagonal, I got a thrombus in the left main. I crushed the thrombus with a stent, but the balloon of the stent was in the left main and it failed to deflate. Yeah.
So let's stop here for a second. Too much information as an intro, like a movie trailer. So what's the reason for the clot? Is what ACT low or what?
Yes, ACT. Actually, at the end of the case, we discovered that the cannula in the patient was out, and it was like 20 minutes after start of the case that thrombus formed. We didn't have our first ACT. But after this, we followed up the ACT and we discovered the problem. We gave heparin in the cannula, and the ACT didn't go up.
And the clot was extending from the ostium all the way to LAD?
From the left main to the LAD, yes.
Okay.
And unfortunately, we didn't have aspiration thrombectomy in our cath lab. To use it, it would have been a better option.
Yeah. So pharmacology, balloon, and then stenting, and then when you stent left main,
LAD.
Provisional to LAD, what happened?
The balloon of the stent failed to deflate.
Okay. Deflate. So what happened? It stayed inflated?
Inflated in the left main, occluding the left main.
Okay.
So I tried with the back of the wire to deflate the balloon, but with no success. I know you should resist your instincts to pull, but I had to pull. I pulled, and the shafts of the balloon was torn. Okay. But it deflated at this time. When it deflated, the patient stopped the chest pain. Yeah. At this time,
it didn't crash.
Didn't crash at this time, okay. Yeah. But we are now left with the problem that we have a deflated, torn balloon in the left main with a wire hanging in the aorta.
The shaft of the balloon is hanging.
The shaft of the balloon is hanging.
And what guide do you have at that?
EBU 3.5.
Okay.
At this time, I got one snare. I picked the balloon with the one snare after several trials out of the patient. But now we are left with the crumbled metal in the left main. It was not an easy path to go with the wire back to the left main LAD. I succeeded with cyan black wire. I re-entered the LAD with multiple balloon inflations. We got flow back, and we got stenting of the bare areas. And successfully, the patient survived and got out of the cath lab.
So when you say you re-enter again, so got flow again, so there's no flow? I got
flow, yes.
There was no flow after deflating the balloon, after taking it out, there was no flow?
Yes, there was no flow when the balloon was inflated. But when it collapsed and torn, there was some flow.
Okay, and then you snared it?
Then I snared it,
There's a flow, but...
There is a flow.
But as you said, the stent is
the
completely
metal layers,
malapposed.
yes.
Okay.
And crumbled from the maneuvers we did.
And you're sure you were luminal inside the stent when you rewired with the cyan black?
Yes, we checked with intravascular imaging. It was, we are in the right track.
And then you...
Yes.
How about the circ? What happened?
The circ was a bit compromised. We decided we used like 400 cc's of dye. We stopped that day. We said we will check after 1 week with a control angiography, but actually the patient refused totally to get into the cath lab again. After hearing what we were saying in the cath lab, he said, I will die, I will not go to the cath lab again. I tried a lot after 2 months, but he refused totally.
Yeah. So let me ask you this: how was the diagonal when you finished the LAD stenting?
Actually, the diagonal was lost at the end of this procedure. We didn't succeed to get into it again.
But did you lose it at the first time when you did the stenting?
Yes, that's what we were doing. We were trying to enter the diagonal.
Is it big?
It was not big, but it was the only one supplying the lateral wall.
I see. Okay.
Yes.
Okay, so maybe why I'm bringing this point is sometimes perfect is the enemy of good.
Yes.
So maybe, you don't know in the hand side, now we're talking the hand side, yes. But maybe you can say, okay.
Actually, I'm thinking this a lot now after the case, because actually when we lost the diagonal, the patient was in no pain.
Yeah.
I keep thinking, what if I didn't try with that diagonal? I would not have that thrombus. I would not have the deflated balloon, etc.
Yeah. Just the idea. But always we would like to have a perfect result for the patient. Yes. What antiplatelet the patient went on?
Aspirin and ticagrelor.
You aimed for a more potent.
Yes, and I think I will keep him for more than 1 year.
Oh, it's challenging.
Yes.
So any patient is doing fine, coming to clinic, seeing you? No issue?
Yes, this was like 7 months ago, and I checked on him like 1 month ago. He was fine till now.
EF is normal?
Yes. EF is no, it was 36 from the start.
Okay.
Yes.
And stayed the same?
It stayed the same, yes.
All right. Perfect. Well, congratulations for bearing out. It's just making me stress out myself just hearing about it. Thanks so much, Mina, for sharing your case. Please watch his videos and others on CVI YouTube channel. This is Chadi from Austin. Thank you so much.
Thank you so much.
Yeah.